Run the Scantrons on both lab and lecture, and this morning I was going through the labs. Our Scantron machine, and it was doing it last week, marks every question 20 and 40 wrong, whether it's right or not. So I have to go through and check each one. Plus, I'm going through questions like the one on the pampiniform plexus, and if you put testicular vein, which I said was correct but not the best answer, I'm giving half credit for testicular vein when the answer was pampiniform plexus. Stuff like that. So I'm at question 27 out of 56. So I should finish that up tomorrow. I don't teach tomorrow until 5, office hours at 4, so I should get that done. I've run the Scantrons for the lecture exam, but I haven't graded the written material. So I'm going to try to get that done and up on Canvas before Friday night. Okay? So just to give you an idea on that part. So we have 2 lecture packets. The first one takes us through the heart, and the second one is blood vessels and blood pressure. So last time I gave them to you at 2 separate times, but they're both in my office, and I want to get the boxes out of my office, so they're both here. All right, so this is all the lecture notes. Okay, this is all the lecture notes for this unit. And then the lab packet, which the printing shop did really, really well. I didn't even turn that in until Monday, and they got it here by this morning. So I was doing pretty well with getting their workshop in. All right. So today, yes.
I had a question about the previous exam. Did you write that test?
Yes.
Okay, because I was kind of surprised at some of the questions.
So the questions?
That were asked.
No, I wrote the test, and those questions are also on some of the quiz questions. So when I did the quizzes, I went back to a couple of previous exams and put those in the quiz bank as well. Well, you may not have seen them in your quiz questions because it's a bank. So the bank is anywhere from 30 to 50 questions for a particular topic. And when I get them back to you on Monday, you're welcome to go over them.
That's the plexus.
Oh, yeah.
This is all plexus.
I won't go through every question, but I'll let you look at it, and if you have questions, you could ask me.
It's a plexus.
Sure. Yeah.
It'll start with vein.
I mean, I'll tell you what page and stuff is on, but if you have a question about it, you're welcome to look at it and come to me and talk to me about it. I don't let you keep the test, but you're welcome to look at it. And I keep it when we're done with the class in my office. If you want me to bring it back to the class, you're welcome to do that. Or if you're doing the Science Success Center, they will ask you to bring one of your exams to look at. And I'll take it over there if you want to do that. Okay, so you do have the lab one to look at it. And then continuing if you want to later on. Okay, so
I don't even get anxiety, but now I'm starting to get anxiety.
So we're looking at cardiovascular system, which is the heart and blood vessels. That's the anatomy, parts of the heart and the names of the blood vessels. The physiology for this unit is muscle and nerve components of how cardiac muscle works. So we don't have any any lower motor neurons for this. It's all autonomic, sympathetic, and parasympathetic that we'll be looking at. And so when we do the physiology on Monday, we're going to do a review of neuron action potentials and skeletal muscle action potentials, all right? Because the heart works the same way as those components do. And then also skeletal muscle contraction is similar, although not identical. So if you want to do some heads up on what to review from last semester for Monday, that's what we're going to review all of it. We're going to review last semester's material, so we're all on an even footing as far as how action potentials and muscle contraction works, okay? We'll review that, and then we'll look at where the cardiac muscle is different. But today is anatomy, and if you recall from developmental material before, when we finished up with the embryo, you can see a little bit of the placenta here, an umbilical cord, and the longitudinal folding has started. And this mass right here is the heart. So anybody remember what the 3 components of the trilaminar disc are? Unless you flushed everything from the previous material. So the surface layer, let's start with the outer. The surface layer is ectoderm. And then cells from that form the inner layer, which is Well, the inner one that forms the epithelial lining, endoderm. I know, I keep putting you off, you wanna say mesoderm. And then the middle layer
Meso.
is mesoderm, all right? And we had 3 different locations or identifications for mesoderm. We had the layer of mesoderm, a component that formed the skeletal muscle. And what do we call that mesoderm? Somatic, yes. So the skeletal muscle is the parietal serous membranes, our somatic mesoderm. And then we have the smooth muscle forming the wall of the gut. You may remember what our word for organ was? Splanchnic, the same as we use with our autonomic nerves. So then this was splanchnic mesoderm. And then the kidneys and the gonads, yeah.
I'm sorry to go back to the test. How is spelling working on a test? Like, do you have to spell everything correctly?
You're talking about for the, on the filling part?
Yeah.
It varies. So there were parts where I said I didn't want abbreviations. So if instead of LH you put luteinizing hormones, I mean if instead of luteinizing hormone you put LH, that's just half credit.
So
that type of
I
thing.
wrote splanchnic, but that's what
You get 1 3 letter. And then after that it's subjective to how close you were to it.
Oh.
Kind of what the quizzes, the lab quizzes that you do in class. Okay? So I do give partial credit on that, just depends on how close you are. So then in the middle here, we have intermediate mesoderm. And we focus primarily on the fact that this is where the kidneys and the gonads came from, forming the urogenital, developing from the urogenital ridge. And so today, and though I mentioned it last week as well, we're gonna focus on, this is where the heart comes from as well, okay? Is the intermediate mesoderm. The heart actually develops from blood vessels, okay? Yes?
Sorry, what was the name of the disc again?
Trilaminar. So when we talked about the inner cell mass, it split to form the amnion in 2 layers, the epiblast and hypoblast.
Okay.
And that was the bilaminar. And then the epiblast formed these 3 tissues. Okay? And then it folded to a tube, but until the folding occurs, it's just the flat disc. All right, so we have, in mammals, we have a 4-chambered vessel, a pump. We have 2 atria and 2 ventricles. And as you'll see throughout this evening, the 2 atria are receiving chambers. The blood is returning to the heart in the receiving chambers and then being pumped to either the lungs in our pulmonary circuit or to the body in the systemic circuit, all right? So we have 2 pumps because we have 2 different locations to go to. Blood that is returning to the heart is it has to flow back to the heart under low pressure because it flows from a high pressure to a low pressure. So where it's getting pumped out of the heart is the highest pressure, and where it's returning to the heart is the lowest pressure, because it's not gonna flow uphill, all right? So the 2 chambers that are receiving chambers are the 2 atria. One receives deoxygenated blood from the body and 1 oxygenated blood from the lungs, and we'll diagram this out. And then we have 2 pumping chambers, one that pumps to the lungs and one that pumps to the body, all right? Now, other animals may have just 2 chambers. So in fish, they have 1 receiving chamber and 1 pumping chamber. Amphibians, like the frog, has 2 receiving chambers, 1 for deoxygenated and 1 for oxygenated, but only 1 pumping chamber. Somebody's phone vibrating? So, why do you think, well, that's up there. So, why do you think we need 2 pumping chambers, whereas a fish or a frog only needs 1? And you have all of those expressions on recorded. So why do you think, as mammals, we need 2 pumping chambers, whereas a fish or a frog only needs what? Nope. Notice here that we're keeping our oxygenated and deoxygenated blood separate, all right? Obviously with one chamber, it's gonna be mixed up in that fashion. What do fish and amphibians have in common as far as their environment development? Water, all right? So if we look at the body capillaries here, capillaries are thin-walled vessels. They're only a single layer of simple squamous epithelia, all right? And so the pressure pushing against that simple squamous epithelia is coming from the force of the contraction. So here the tissue capillaries are surrounded by the fluid of the tissues. Here, the tissue capillaries are surrounded by this is in the gills, so it's going to be surrounded by the water of the lake, or the ocean, or the river. So in both locations, capillaries are surrounded by water, okay? In humans, we have water around the capillaries in our tissues. What's around the capillaries in our lungs? A very little bit of tissue fluid, but mostly air, all right? So if we pump blood to the capillaries of our lungs with the same force that we pump blood to the capillaries of our body, where there's only air up here trying to collapse the capillaries, and here there's fluid, that extra force here is going to cause edema. It's going to cause fluid to move from the capillaries into the alveoli, into the air, and cause pulmonary edema. Here, there's the same resistance, fluid on both tissues, so the same force can be used to push the fluid into those two sets of capillaries. If we try to do that as humans, that greater force is going to end up pushing fluid across the capillaries. And obviously that is what pneumonia is fluid in the alveoli and pulmonary edema. So we have two separate pumps so that the right ventricle pumps with less force than the left ventricle, okay? Both will pump the same volume because this is a circuit. What goes to the lungs is not going to the body, and what comes back from the lungs is going to go to the body. What comes back from the body is going to go to the lungs. So it has to be exactly the same amount being pumped out of the body. Otherwise, we start getting congestive heart failure. We get different amounts. So having a strong pump and a weaker pump means that when the fluid gets to that region, it's under lower pressure if it's going to the lungs, okay? Now, in the fetus, is there any air in the alveoli? No. So the fetus could get by with just a single pump because its alveoli are filled with fluid so that it doesn't grow solid lung tissues. It can't just all of a sudden develop empty air sacs once it's born, nor can it all of a sudden develop an extra pump. So it develops for the environment in which it's going to grow, the air in the lungs, not the environment in which it actually is with development, okay? So that's the reason why we see the 4 chambers in the heart and the human as opposed to those amphibious animals. So looking at development, this is very complicated and we're not going to get into the complicated part, okay? You would think with computer animation, somebody in the last 30 years would be able to figure this out. But essentially, and I'll show you some pictures of it, I'm just not going to ask you to know all the stages of that. What's on this chart here, this diagram, is what I want you to know, okay? So we start out with two vessels. I don't know if you remember that in our embryo thing, we had 2 vessels on either side of the folding embryo. And in the region of the thoracic cavity, they fuse together. So this looks very similar to this situation in the fish, okay? And so, in fact, as a high school student, my senior biology class was ended up being a college level anatomy and physiology course with cat dissections, and we had to do not a research project as far as primary research, but we had to do a research project. This was back when you go to the library and do photocopy, it was in slip paper. And I was just grateful I didn't have to take hand copied notes of everything. And so my project was on heart development. And I took fish hearts and frog hearts and cat hearts and put them in plexiglass. You know, you can make your own little paper weights and stuff, and follow through that development. So I've always had a kind of a soft spot for how the heart develops in this location. So in the human, in the embryo, The heart starts to beat about the beginning of the 4th week, so day 21 or so. Okay, so after 3 weeks. And this is all it is. It's just a single, one receiving chamber, one pumping chamber, but just a single channel. And then it goes through this amazing folding where the receiving chamber that's at the bottom here ends up being at the top. And the pumping chamber, which is at the top, stays at the top, and it rotates and it bends back, and walls fuse and walls disappear, and they even rotate, and we end up with our 4-chambered heart. Okay? So it's a very, like I said, all the internal structures here are more complicated what's happening internally. But what I want you to know is we start out with 2 arteries, 2 vessels, and they fuse to form one, and the heart develops from that one single vessel, okay, into the 4 chambers that we eventually have. So here we have the different vessels of the body coming in. You can see they're just going through one, receiving at the bottom, and going through one tube and being pumped out the top. That's what we see early on at day 21 when the heart starts to beat. So this is just the 2 vessels in the cross section that we've talked about, okay? And then they come together and fuse. There's a lot of other pictures and names on here that you don't have to worry about. It's just the concept of those 2 chambers forming one. And then again, you don't need to know these terms. I just want to give you an idea of that complicated twisting and how amazing it is that we don't have more children born with birth defects in the heart area. So here's the receiving chamber. Here's the pumping chamber. As it goes through and it starts to migrate.
Is it upside down?
Well, it starts out looking like it's upside down, but the ventricles, it ends up doing this. So we start out with a tube that rotates like that, okay? And so here's the atria, and here's the pumping chambers down here. Let me go through that one more time. Again, I don't want you to have to learn the ductus cordis and truncus arteriosus. I just wanted you to see a little bit of the complicated components here that are occurring. This is just outside. Inside, we have all the walls forming and valves forming. It's starting to rotate back for the receiving chambers, the atria. And then moves up here, and then finally we have the more adult heart. Okay, this is kind of a combination of all those pictures. But again, to reinforce, this is what I want you to know, is this for development, okay? So let's look at the adult heart now, or at least the postnatal heart. This is showing the surgery on heart transplant for a small child, infant, like under 1. Okay. I'm gonna go back to this image here. Last year, I don't know if Jeff has talked about it with some of you, but he works with the paramedic program over at Sac State, and twice a year, the paramedic students are come over to the coroner's office for Sacramento County, and in groups of 15 to 20 times 2. We take them through a person who has died, hopefully has not been refrigerated or frozen, well, refrigerated but not frozen. So these are unembalmed individuals. And the first time I saw an unembalmed dissection was working with Jeff. So it usually gets Dr. Wan and myself and maybe 1 or 2 other faculty or former students to go over and help them get ready, because we have about an hour to get them ready before the students come in. They're paramedics, so they're primarily interested in the heart, and they practice intubating them. And so last fall, or was it spring, a year ago spring, we had completely both females. The first female had died of esophageal cancer, and her heart was literally this size, a little smaller than this. She was probably about 5'6", and this is a child-sized heart. And it was flabby. I mean, even when we cut it out, there was just hardly any muscle there. The very next day, that was a Tuesday, the next day on a Thursday, the woman had congestive heart failure, and her heart was this big around. Unfortunately, we have to ask about 6 months in advance to get permission to take pictures. So I didn't have any pictures to take of, but we had this tiny, tiny, tiny little heart. And a lot of things that you read will say the heart's the size of a fist. It's really almost 2 fists. Okay, so it can be pretty tiny. All right, so question number 1. This is in class lecture 7.
So sometimes babies can be born with a hole in their heart. So does that obviously it happens during
So
development?
remember I said internally the walls break down and walls form, so it's in that process. It's called the endocardial cushion and the growth of that, and it's usually, there's a hole already there. That we'll talk about because the blood doesn't need to go to be pumped to the lungs, all of it, enough to get nourishment, but not to go there to get oxygen, because it's not going to get any oxygen. So sometimes that, which is more like 2 flaps, doesn't fuse after birth. But then when a hole that's not supposed to be there develops in the ventricles. And that's where that endocardial cushion growing upward just doesn't quite meet. Yeah. Okay, nice when the answer is up on the board for you already. So the heart is considered to be in ventral or dorsal cavity? Ventral. And above the diaphragm, we call that the thoracic cavity, all right? Do you remember what we call the thoracic cavity? The part of the thoracic cavity does not include lungs and does not include pleural spaces. Mediastinum or mediastinal cavity, okay? So everything that's not lung and not pleural cavity, so this area here, the area behind it, the area between the heart and the sternum, and if we were to strip off the parietal pleura, any nerves there, is called the mediastinum, okay? So the heart's in the mediastinum, the thymus is in the mediastinum, the trachea, the autonomic nerves, the vagus nerves, all of those are in the mediastinum. If it's not the heart and the pleura, it's mediastinum, okay? And then we have different regions of the mediastinum. So if you look at the transverse view for the thoracic cavity, and we have the pleura. So that's not mediastinum, okay? We put a little indentation here for the heart. So that, wherever we find the heart, is identified as the middle mediastinum or mediastinal cavity. Those are interchangeable. So all right, there's not much space here for this, you have the sternum. So between the heart and the sternum is identified as the anterior mediastinum. Okay, and then there's not a lot of room behind the heart, but in all this space, and if we pull off the parietal pleura, we have some autonomic nerves back there, the sympathetic chain of ganglia that run up and down. That would be the posterior mediastinum. And then it's impossible to show on this particular diagram, but if we look at the base of the heart here, above that would be the superior mediastinum, okay? So that's primarily where we find other structures that are not the heart. So the thymus, depending on the size, can be in the anterior or superior. In adults, it's going to be superior. The great vessels, the aorta branches and vena cava branches, the trachea, those are all superior mediastinum. And that's where we find most of the components. Okay, so this is the view that I just drew on the board, and we're looking at the superior portion of the heart itself. All right, before we talk about the layers of the heart wall, let's look at the borders of the heart. Okay, so anterior surface, posterior surface, right border, left border. So the heart is situated not in the center of the chest cavity, but slightly to the left, all right? So just deep to the sternum is gonna be midline. So just deep to the sternum, we have the right atrium and right ventricle, okay? Left ventricle is gonna be on the far left side, the part of it, the third. And posteriorly, we have the rest of the left ventricle and most of the left atrium, okay? So if you wanna go ahead right now, actually, and get a heart model for every 2 or 3 people, then as we go through the structures of the heart, you can incorporate lab activities with the lecture component.
Do you always win at dictionary?
I don't actually know if I've ever even played it. And I know what it is, but. All right, so the right atrium. And we look at the right ventricle. We see kind of a groove. This is going to be right ventricle and left ventricle. So the right atrium and right ventricle form the right border of the heart, okay? This position becomes a little more important in x-rays because when we do our respiratory system, a collapsed lung with increased air or fluid in the pleural cavity can cause a shunt in the heart, either to the left or to the right. So if you realize it's already over partially to the right, to the left, that's going to affect inflation of the lungs, especially if it gets shifted over even farther. The inferior border of the heart is very close to, if not resting on the diaphragm, because the diaphragm can go up and down. Okay, so it's not uncommon for that movement of the diaphragm to help actually move the lower part of the heart down to help with flow of blood back into the heart. So this is the inferior diaphragm. And inferior border. So inferior border is primarily right ventricle, 2/3 right ventricle, 1/3 left ventricle. And left border is primarily left ventricle. You can see a little bit of the left atrium here, but the atria of the heart have little cauliflower flaps called auricles, which don't contain very much volume. So this little bit right here, this would be the left. This is called the auricle, so you're not seeing very much of that on the left side, okay? Most of the left atrium is actually on the posterior surface. So all this kind of tan colored region is the left atrium. So that's what you're gonna feel if you put your hand behind the heart, between the heart and the vertebra.
On that thing, where's the inferior border?
You're not right here. So this still has the pericardium around it. You're not actually seeing the heart itself. But this is the inferior border resting on the diaphragm. So right border, let's see if I can get a view where the pericardium is not in place. So here's the right auricle and atrium, right ventricle, inferior border with most of the right ventricle, only about 1/3 of the left. And if we look on the left side, for this individual, most of the left border is the left ventricle, with just a little bit of this flap, this auricle. As I said, most of the left atrium is posterior, and most of the left ventricle. So 2/3 of the left ventricle is posterior, about 1/3 is anterior. Okay, so these are proportions when I say the left ventricle. We don't have any of the right ventricle over there, but most of the left ventricle is going to be on the posterior aspect. This is the apex, which is weird because it's coming to a point, but it's actually the bottom of the heart. Apex just means point, okay? So it's not the top, It's the bottom. When we get to the lungs, it will be at the top. This is at the bottom, and then the base of the heart is just to kind of draw a flat line where the blood vessels are coming out, and you'll see that with the sheep heart today. That's the base. Okay? So then for anterior surface, and don't memorize this by the time you study it. I mean, I'm not saying I don't want you to know it, but by the time you study it, you'll be able to figure out which parts are where rather than just kind of memorizing a component. So anterior surface is going to be right atrium, right ventricle, and a little bit of left ventricle. Posterior surface is going to be left atrium and 2/3 of the left ventricle. Okay, just a small amount, 1/3 of the right ventricle.
Do you need 1/3 of the left ventricle on the anterior surface?
Sorry, take half. Thank you. So the way the hearts are on the pedestals, on the mount, is the anatomical position, okay? And we'll refer back to that when we refer to the lineup of the inferior and superior vena cavas and so on, okay? So now let's look at the layers of the heart wall. If you recall, with the uterus, we had the perimetrium, or the outer covering. The muscle was the myometrium, and the epithelial lining was the endometrium. Okay, the metrium is our root word for uterus. So with the heart, our root word for heart is cardiac. So we have an outer covering, which is the pericardium. Not quite exactly the same, but close as far as what tissue makes it up. The heart muscle itself, the cardiac muscle, is myocardium. And then the lining, simple squamous epithelia, and underlying connective tissue is endocardium. Okay? So may I erase this diagram? All right, so this is the heart up here where the pulmonary trunk is coming out, okay? So this is kind of showing the region that I'm drawing on the board. And this is cardiac muscle, so this is going to be the myocardium. All right, that's where we're going to be talking about the physiology. Then, lining the inside of the heart, we have a simple squamous epithelium, which is continuous with the epithelium that lines our blood vessels. And that's all our capillaries are, is simple squamous epithelium. And a loose irregular connective tissue that attaches it to the muscle. So with tissues, talked about membranes, and deep to every epithelium is loose irregular connective tissue. Okay, so this is attaching it to the underlying muscle, and the heart's pretty thick, so there can also be some dense irregular. The same. All right, now on the surface of the heart, it's been stripped off of the models because normally when we have the pericardium on the heart, as you'll see with the sheep hearts this evening, we can't see much of those surface blood vessels. It takes about 4 to 6 hours to dissect away the connective tissue and the adipose tissue and be able to see the blood vessels that you can see on the surface of the hearts. So that's visceral pericardium is still intact. Let's review that pericardium just a bit. So here is the heart. and it develops into a essentially bag of simple squamous epithelia with connective tissue to attach, all right? So that simple squamous epithelium is going to be attached to the surface of the heart and then continue around like that. So this is the pericardial cavity, which is a closed cavity, all right? So, hold on one second. I'm going to go grab a visual aid. So this is my pericardial sac, all right, it's closed. It has about 15 mils of a serous fluid inside it. All right, which is made by the simple squamous epithelium. So this is what I've drawn up here in green. So this is a simple squamous epithelia. And attaching it to the heart, as I've written over on the left, is loose irregular connective tissue, okay? Inside the pericardial cavity, we have serous fluid. Made by that simple squamous epithelium. The heart is not in that pericardial cavity, okay? It's wrapped around, the pericardial cavity will wrap around the heart. Just like this. Have I gotten the heart wet? No. The outer layer that you see here is the, I've got to be careful how I open this or I'll have the water all over the table. The outer layer is the parietal pericardium, okay? Just like we have a parietal pleura and a parietal peritoneum. Now if I do open this, so now I've cut the parietal pericardium, I'm opening it up and exposing the heart. Am I actually touching the heart? No, I am touching visceral pericardium, okay? So the only thing in that pericardial cavity is serous fluid. It's as if you were camping, you got cold, you got out of your sleeping bag and went to sit by the fire. You got cold again, so you went back and got your sleeping bag, and you did climb inside it, you wrapped it around your shoulders. So you're not in the sleeping bag, it's wrapping around you. So the pericardial cavity is wrapped around the heart. And the only thing inside it is the serous fluid, okay? So let me leave that up for referral. So now when we come back here, here is